You are welcome to resume our nursing clinical case presentation program. I think this is the summer, or after summer, let's say. Welcome back to all people who spent their vacation this summer. Except me, I was here. So I hope that you will enjoy with us today in attending this case presentation. I will mention the name, or I will say the intensivist. Okay, I will not mention. I will not mention anything, just you are welcome. I wish you all the best. Inshallah, you will enjoy all of you.
Thanks, sir.
Actually, no need to say welcome again because Mujahid already said welcome. But I want to say welcome from behalf of ICU to Dr. Hazim, our Dr. Fauzi, Dr. Karam, Mr. Mujahid, all head nurses, nursing staff, midwife, welcome to our case presentation. So as usual, my staff told me don't mention the name. They want to mention the names. So I just want to invite her. She can start.
Welcome to the new episode of The Intensivist.
My father is an was Budd-Chiari suffered for 25 years. He is very active, not complaining of anything, and never been hospitalized. He's actually finished his contract with his employer. He's just looking for his ticket. And then one day, suddenly, he complained abdominal pain, nausea, and he started to vomit and become confused. And so, I rushed him to ER. And there's a lot of series of laboratory work, diagnostic tests. And then, few days passed, my father went to ICU, then he was intubated, and his body became frail. And he was never opened up. Then, until suddenly his body gave up. Now a body from supposedly enjoying his family with the Philippines. Now he will return back in cold casket.
A pleasant day, everyone. Good afternoon, Christian.
Nice to see you, Jess. It's a great day indeed because today we will be learning. But before that, we would like to acknowledge the presence of Dallah Hospital Director of Nursing, Mrs. Francisca Villamil, and Nursing Educator, Mr. Mujahid, doctors, and to all nurses. Welcome to the Intensivist.
Patients come and go in the hospital. Doctors are treating them. Nurses play an important role in their lives. They carry out doctor's order as well as they give their utmost care. They touch your lives, connect with them, but deep inside them, patients made an impact in their lives.
We just saw a while ago a video regarding one patient from Dallah Hospital. A 69-year-old male patient came to ER, complained of nausea, vomiting, and abdominal pain.
In spite of 1 week from GCS 15 went down to GCS 9, dropped to GCS 3 over 15. Initially, doctors cannot identify the right diagnosis of the patient because its weight is similar to other illnesses. That's why we invited intensivists to give us more knowledge of this kind of disease,
The Budd-Chiari syndrome. So now let me introduce to you our first intensivist. A resident physician of Intensive Care Unit of Shifa International, Pakistan, Dr. Rifat Nazar.
He is a specialist anesthetist in the Division of Gastroenterology, George Washington University, Washington, D.C., Dr. Randolph Saneta.
An intensivist from St. Luke's Hospital, Manila, Philippines, Dr. Lailani Palami.
India, Dr. Sumi Matthew.
A consultant, Clinical Division Evaluation, Biologic and Gene Therapist, Directorate Health Canada, Dr. Jinky Manala.
A Director of the Division of Gastroenterology, Johns Hopkins University, Dr. Joaquin Lim.
Welcome, doctors. Good afternoon. May you take your seat now.
First and foremost, we would like to know how this Budd-Chiari syndrome started. Dr. Ripat?
Good afternoon, everyone. Thank you, Des. Thank you, Kristen. I will give you a little overview of Budd-Chiari syndrome. This Budd-Chiari syndrome is a condition that is characterized by thrombotic or non-thrombotic obstruction of the venous hepatic outflow. It's characterized by hepatomegaly, ascites, and abdominal pain. The men behind these names are, in 1845, a British internist named George Budd. He described the clinical triad of hepatomegaly, ascites, and abdominal pain. It was in 1899 when an Australian pathologist named Budd-Chiari, he described the pathophysiological features of what now known as Budd-Chiari syndrome. The prognosis is poor in the patient with Budd-Chiari syndrome who remain untreated, with death resulting with progressive liver failure from 3 months to 3 years from the time of diagnosis. Following photosystemic shunting, however, the 5-year survival rate in the patient with the syndrome of 38 to 87%. Following liver transplantation, the 5-year survival rate is 70%. There are some risk factors that causes Budd-Chiari syndrome more likely for blood to clot. It's included some hematological disorders, like clotting disorder, Then there is some premature breakdown of the red blood cells that we call paroxysmal nocturnal hemoglobinuria, excessive number of the red cells that's called polycythemia rubra and sickle cell diseases.